This is Abia COVID-19 update.
Abia COVID-19 update.
Well, permit me to start today's show by refreshing our memories on COVID 19. Coronavirus disease 2019 COVID 19, an infection caused by severe acute respiratory syndrome. Coronavirus 2 SARS-CoV-2 has taken the world by surprise. One of its most significant properties is the fast-paced nature, one that has been difficult to keep up with. The first case of the disease was reported on the 31st of December 2019. It means coronavirus will be 1 year old tomorrow, almost 12 months later, and it has spread to about 217 countries, affecting over 77 million people, causing almost 1.7 million deaths. Closely related is the development of vaccines to tackle this infection within a span of 9 months, a feat that usually takes several years. Of course, it is known to be transmitted primarily by infected respiratory droplets releasing on coughing, sneezing, and speaking. One thing that should come to your mind now is masking, I believe, and these are some of the issues we will be looking at today. And contact with infected surfaces and objects, of course, followed by exposure to your eyes, your nose or mouth. Don't forget sanitizing also here, and physical distancing. Onset of symptoms usually occur between 2 and 14 days after infection, and mostly commonly include fever, dry cough, and tiredness. Well, interesting. This is COVID-19 update, Abia State COVID-19 update. A program sponsored by the Abia State government through the Interministerial Committee on COVID-19, the third edition for the week. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as the state governor's efforts, Dr. Okeze Ikpazu's efforts in ensuring that the state is safe from the virus. This program is running simultaneously every weekday on several radio stations in the state, Mondays through Fridays on Flow 94.9 FM, BCA 88.1 FM, Vision Africa Radio 104.1 FM, Family Love 99.9 FM, all in Umuahia, the capital of Abia State. We're also live in Aba through Bars 89.7 FM and Real 99.1 FM. Let me bring you up to date on figures and updates on coronavirus globally. As at 8 a.m. today, there are over 82 million confirmed COVID-19 cases globally, and about 58.4 million recoveries and 1.7 million deaths. Don't get it twisted. Those numbers are people. Well, a coronavirus vaccine developed by drug firm AstraZeneca and Oxford University has been approved for use in Britain. The UK government says the mass rollout will start on the 4th of January next year, and the vaccine can be stored, transported, and handled at normal refrigerated conditions, and is therefore cheaper and easier to administer than the Pfizer and the Moderna jabs that we know that requires freezing. And Britain will become the first nation to roll out these jabs on the 4th of January. Health Secretary Matt Hancock said amid mounting concerns that another dangerous spike in infections threatens to overwhelm the UK. And now Chinese pharma giant says phase 3 trials of a Sinopharm coronavirus vaccine is 79% effective, lower than rival jabs developed by Pfizer and Moderna, but a potential breakthrough anyways in the battle to stem the pandemic in Asia. And China has been racing against the West to develop its own coronavirus vaccines, with 5 already in large-scale phase 3 clinical trials. And in Nigeria, there was the COVID-19 PTF daily briefing yesterday. And Nigeria is here to test up to 1 million people for COVID-19, several months after announcing plans to do so, and nearly a year since the deadly virus arrived in the country. As of 7 p.m. yesterday, the country has tested 937,712 samples, and the Minister of State for Health, Olorunnibe Mamora, at the PTF National Briefing yesterday, said the country will focus on vaccine procurement in the first quarter of 2021. But those vaccines purchased from any available point of sale or country will be subjected to National Agency for Food and Drug Administration and Control regulation. And of course, authorities in all the 36 states of the Federation and the Federal Capital Territory have been asked to reopen all laboratories and scale up the testing for COVID-19. Boss Mustafa also spoke yesterday and said Nigerians may have to brace for tougher measures to be adopted by federal government in the coming days in a bid to curb the spread of COVID-19 in Nigeria. Chikwe Hiekwazu, NCDC boss, that's the Nigeria Center for Disease Control there, saying that we should brace up, that January would be a tough month. Very important. And he explained that week 52 has recorded the highest number of infections since the outbreak of the virus in the country in February. We're bringing it back home tonight to Abia State, and of course our focus today will be in Abia State. We have the state epidemiologist in the studio joining us live, but before then we had the secretary to the state government and the chairman of the committee, Barrister Chris Ezem, yesterday, and he hinted at a possible lockdown of the state if the spike in the number of confirmed cases and the abuse of the preventive guidelines of COVID-19 continues. That's the government talking tough there. They're saying COVID-19, he said all measures earlier set up to stem the tide of the infection have been restored. And he said the state government aligns completely with those protocols and the directives given by the federal government, and a possible lockdown if there is the need. So it is very important that we follow some of these protocols. And so many persons don't even make use of their face mask again, and it's not a funny thing. And there is an ongoing operation, Know Your Status campaign, to get tested.
This is Abia COVID-19 update.
Abia COVID-19 update.
All right, straight to today's discussion. We have Lady Peace Nwogugu joining us in the studio. She's the state epidemiologist. Lady Peace, it's been a while. Welcome back to, I will call it situation room here for we broadcaster journalists in Abia State as far as COVID-19 is concerned. Welcome.
Thank you, Mike. I've really longed to be here.
All right, welcome back. We have a situation at hand. Let's get the situation reports from Abia State in terms of testing before we go straight to other discussion for the day.
All right, thank you very much, and lovely Abians. Merry Christmas and prosperous New Year in advance, despite the pandemic and all the difficulties they have said we are going to face. By God's grace, if we are able to adhere to instructions, it's not going to be very difficult for us. Yeah, since 20th April, when we recorded the first two cases of COVID-19 in Abia State, as at yesterday, we have 999 positive cases confirmed.
999,
yes.
Okay,
in
confirmed cases.
In the past week 52, we recorded 12 cases.
Okay.
And in this week, week 53, we have recorded 1 case. That was yesterday. Then we have discharged successfully 968 patients.
Successfully managed,
and
discharged.
Yes. And we have 21 active cases. And 5 are in a treatment center in Amachara and at FMC. While 16 are on supervised home self-isolation.
Okay.
Supervised in the sense that they report to the center after assessment and being satisfied that they are capable of isolating at their homes. They will be given medicines and they'll go and continue isolation at home, especially if it's a...
I'm sure there are guidelines to
there
be met.
There are guidelines, yes.
Okay.
Especially if it occurs maybe 2-3 odd members of the family. That is what we have. Maybe 3 members of the family, they tested, they're infected. Okay. And you see now the isolating at home will be easy for them.
Interesting. That's the situation report.
And so far, we have done more than 12,000 tests.
In Abia State?
Yes.
Interesting. So, about case search, I want to know, how are you going about it? Do we still have testing ongoing in Abia State at our various testing centers?
Yes, before now, after the community testing, and because we want to do everything to ensure that the test is made available to everybody, no matter the distance from the center, Ohafia, Aruchuku, Ikuano, Okwa West, Okwa East, we have sample collection sites in all the LGS, and in all we have 20 sample collection sites in Abia State.
Okay, 20.
And yes, 20 sample collection sites, and they're all functional. And we have their fact. I even came here with the contact phone numbers of these sample collection sites.
At the various local governments.
Yes, because the time they were established, they were given phone numbers and phone lines so that their LGS can also, people can, if you are not able, maybe you have a problem, you cannot get to that place immediately, you can call from your home.
Okay.
And they will guide you. Yes.
Now let's, before we're going to reel out the numbers, so maybe at the tail end of the program.
Yeah.
The numbers, so you get your pen and your paper ready. The numbers you can, call in case you are in a particular local government and you want to get tested. But there are some symptoms that you should exhibit first before you can say, yes, I'm going for tests. You cannot just stay at home and say, I'm going for tests. Or is it necessary for everyone to test? Because I understand there is an operation ongoing now, Know Your Status campaign.
Yes, if maybe you feel unwell and you are not sure, or you have been exposed, you are sure that you've been exposed, you've come in contact with somebody who was confirmed, who was suspected, or a returnee from places that have active transmission, and you feel unwell, you can call and get your sample collected and tested, so you'll be sure that you are, because most people will not even manifest any symptoms. They will feel they think they were well, but meanwhile they've been infected, and they will be able to infect others who will come down seriously ill with infection.
Interesting. So as it stands now, private hospitals and the vulnerability of our health workers, I want us to look at it. Private hospitals are admitting patients at the slight, in Nigeria it's very common. We have any case, you start treating malaria at home before you go to the hospital. You even instruct the doctor sometime, and sometimes you instruct the health workers, treat me for malaria. As soon as I take the malaria drugs, and I will be better. I know you will have something to say to them, those private hospitals admitting patients even without COVID-19 tests.
Yeah, the most important thing is that all hospitals, all health facilities should, as much as possible, maintain a high index of suspicion and observe what we call IPC measures, infection prevention control measures,
okay,
to ensure that once you are treating anybody, you consider that person maybe as having infectious disease, so that you don't yourself come down with infection just in case that person is infected without you knowing. Because once anybody around there gets sick with fever, headache, first suspicion is usually malaria. And once you get to the hospital, they will start treating you with malaria then before they run other tests. And because these tests are not run in the private hospitals, I advise that all private hospitals should maintain a high index of suspicion for COVID. Once you give somebody malaria treatment for 1-2 days, that person is still having these symptoms, the person should be advised to get COVID. You invite us, we can come to the, you do it. We go to the private hospitals to collect samples of people who are in admission in this hospital, so that you know the person's status, so that the doctor will not get himself infected and in turn infect other patients.
Interesting. Let's talk about the vulnerability of our health workers. Are they well protected?
That's what I'm saying. Because what it takes is wearing of nose mask, hand glove before you attend to any patient. Because at this time you don't even know who is infected or not, who has the virus or not. So it's very important from your gate that the gate man, the receptionist, everybody, the front desk nurse will be on face mask. There should be sanitizers on every table. There should be wash hand stations at the entrance of the hospitals, and the doctor too. And before you handle any patient, you wear at least observe some standard precautions.
Okay, Lady Peace, I know you are so worried by the level of compliance to these protocols you've listed this morning on the program, especially in Abia State. I was opportunity to be in the bank yesterday, and I can tell you that it's business as usual.
Yes.
it's business as usual.
Yes.
You can walk into the bank without your face mask. I wouldn't mention the name of the bank. You
Not
can walk into
all the
into-
banks, not just any bank.
Interesting. I'm
Bef-
so happy
They
that
won't permit you to enter into the banking hall without face mask. And once they get into the banking hall, you see everybody removing the face mask. Even the bankers, the workers there, nobody's wearing face mask. The
And
other
even
day I was in a
sanitizing,
bank.
uh,
Because I would normally wear my face mask. I see others, they were without face mask, they won't open the door for you. But once they get there, not even the customers, not even the bank, nobody was wearing mask. And I told the
and
banker,
crowd control.
it's not even there. They are controlling the crowd, maybe from the entrance. And once they get there, they still come close to the
Now,
people
my
walking
question, it brings to the question, are you not worried with the level of compliance by Abians?
there. We are worried. And that is why we are here. Because we've been taking on this campaign since beginning of this year. And now we are still launching this campaign. And we've not relented. So I'm still worried that people maybe they still live in denial
a common man on the street.
That it does not exist.
A common man on the street will tell you COVID that didn't kill us during the hike of the
That it will not even
transmission.
kill them because they're Africans or whatever.
Now,
They're really
we are
specially
coming back
immune.
to say we have second wave. So I would like you to reel out those protocols again, the non-pharmaceutical protocols.
Yes, non-pharmaceutical
For
interventions.
sensitization.
Yes. One, like I always say, your health is in your hand. Hand hygiene is very important. Wash your hand frequently. If you don't have water available, use your hand sanitizer. There are small bottles you can put in your pocket. Most importantly, wear your face mask in addition to physical distance. And now we're in festive mood, celebration, festivals everywhere. As much as possible, avoid mass gathering. A lot of people get infected after attending mass gatherings. Avoid mass gatherings. And if you must be in a mass gathering, wear your face mask. Tell your neighbor, your friend, your relative to put on his face mask. If you're masked up, you are your mask up, nobody will get infected. And then back at home, frequently touch places like table surfaces, you clean
disinfect.
and disinfect frequently.
Now, Lady Peace, a lot of young persons get infected without knowing, and they transmit the same infection, the same virus, to an elderly person who is vulnerable. Maybe because of an underlying ailment
And age.
So I don't know what would be your advice to them, for those that are throwing caution to the wind that say, I'm young, I can't go down with coronavirus, forgetting that they have parents
At home.
forgetting that they have
Elderly
ones at home.
That's the problem, because they are up and about. They are the people who are always on the streets. Everywhere you have mass, you see young people. That is why most of the cases are in that age bracket. But the people who come down seriously ill are these other ones who are at home. Like our first two cases, they are elderly people who don't even move about much, but they got infected. How? Because somebody who is infected without knowing must have come visiting, must have attended to them, and they get infected and they came down seriously ill. So what I always say is that if you have elderly ones at home and you know you love them, you won't want to lose them, or you won't want them to come down seriously ill, limit the way you go about, you mix in the crowd without you be getting protected. Because you consider them, they are ones at home and you are the one that go out. If you are going out, you put on your face mask. And also it's necessary, even especially at this time that you see people returning from everywhere, from far and wide, that you limit visitors in the house coming to visit these elderly ones who we consider to be most vulnerable.
It's against our tradition. It's the festive season, Lady
Yeah,
Peace.
it
That will be
is.
difficult to.
That is why we are saying when we publish our end of year travel advisory,
Yes.
we advise that people, if you don't have much serious business, maybe with your friend, you can communicate using your phone, using social media platforms. At least you avoid coming close contact with people. Avoid hugging and handshaking. You can greet your friend, your neighbor, your relative from far. That's distancing of at least 2 meters, 1.5 is important.
All right. Interesting. It is Abia State COVID-19 update live on several radio stations in the state. And what we are saying is that there is a new variant out there and you should take necessary precautions. And in case you're doubting and your suspicion that you have COVID, we have a telehealth support center line that you can call 0700 2242 362 0700 2242 362. Just as we have collection points in all the 17 local government areas of Abia State, and we will be reeling out their contact now. Lady Peace.
Okay, thank you very much. Just like we said, you are at home and you feel unwell, you need help, you call our Abia telehealth line. Mike has already given us that. Then you are far, you are in Aruchuku, you are in Abanot, anywhere. In Abanot, the sample collection site is at the health office, and the contact is 0703 516 1732. I'll take it again. Abanot 0703 516 1732, and it is at the head office. Then in Abanot again, and that sample collection site is at IDH, Infectious Disease Hospital, and that is where we have our second isolation center. The contact is 0706 421 9077. IDH again 0706 421 9077. At Aba South, the site is at the town hall, and the contact is 0704 888 5349. 0704 888 5349. Arochukwu is at Uku Akwo PHC Ututu, and the contact is 0704 819 1893. Arochukwu 0704 819 1893. Ben the LGA Ozitem Isiebu PHC 0704 899 5020. 0704 899 5020. Ikwano LGA Amawon PHC 0902 910 7662. 0902 910 7662. Isialangwa North LGA Ayabubi PHC. Contact is 0816 040 4357. 0816 04 4357. Isialangwa South Umuenge PHC 0704 886 3318. 0704 886 3318. Isukwato Ukunwangu PHC Uturu, and contact 0903 540 6955. 0903 54 6955. Obingwa Head Office, Obingwa Council Headquarters 0704 722 6564. 0704 722 6564. Ohafia LGA is at Isiama PHC, and contact is 0704 814 0481. 0704 814 0481. Osiomangwa is at the health office, council headquarters 0704 702 9710. 0704 7029 710. Ugunabo Health Office, Council Headquarters 0906 563 6702. 0906 563 6702. Okwa East Amakam PHC, Akwete 0704 855 8156 0704 855 8156. Okwa West Obenhe PHC 0704 814 7366 0704 814 7366. Omahia North Omoda PHC Isingwu 0704 86 77958 0704 86 77958. Then at FMC it is still on. The contact is 08033 809 738 08033 809 378. Omahia South Amibo PHC Obakala 0704 850 8591 0704 850 8591. Then Abia State Specialist Hospital Amachara, where we have our isolation center and treatment center and also our laboratory 0703 49 36 857 0703 49 36 857. Umunnochi Health Office 0702 63 60 352 0702 63 60 352.
All right, thank you very much, Lady Peace. Our time is fast spent. Many thanks for being part of the program today. Lady Peace is the Abia State epidemiologist. The program returns tomorrow. My name is Michael Oni.